Guys, welcome back to my channel. I'm Janeospace, your community of Papa, and this channel is about health education for kids and adults. Kindly subscribe to this channel and be part of this beautiful family. Guys, we are blessed today to have a doctor on this channel. I have with me here Dr. Iwua, who is coming to talk about septic abortion. We've been seeing it most often, and I talked to him about it, so we made this video so people out there will have a view of this septic abortion and then how to go about it. So help me welcome Dr. Iwua to this channel. So hi Doctor.
Hi
guys. Welcome to Janeospace. So doctor will take us through what septic abortion is, the causes, the signs and symptoms, and then the management of it all. Septic abortion. What is septic abortion? We would like to know about it first.
As we know, it's made up of two words, septic and abortion. And when we say septic or sepsis in medicine, it's essentially an infection that has overwhelmed the entire body and is causing a lot of issues or problems, which are seen through the signs and symptoms that the patients manifest with. Then when we say an abortion in Ghana, an abortion essentially is the total or incomplete extraction or extrusion of a fetus from the mother before the fetus is viable. In Ghana, we have the cutoff being 28 weeks, or roughly, let's say 7 months, or if the weight of the baby is less than 500 grams. So when you add this together, it means septic abortion is essentially any type of abortion which leads to an infection that overwhelms the entire body.
Okay, all right. So thanks so much, doctor. So the next thing to also ask doctor is about the causes of this septic abortion.
Okay, so like I said earlier on, the septic abortion is essentially coming from any other type of abortion. So we have a threatened abortion, we have complete abortion, we have incomplete abortion, we have missed abortion.
Missed miscarriage.
Do you get it? Exactly. So if any of these abortions occur and there is an infection which overwhelms the body, that can be termed as septic abortion. Okay, so it comes usually from either spontaneous abortion or an induced abortion, and if there is an infection as a result of that, then you say that we have a case of septic abortion.
And has this septic abortion? We want to know the signs and then the symptoms about this septic abortion.
Okay, so the signs and symptoms, I'm going to lump both together because what the patient feels and what you see sometimes are the same. So, first of all, it's an infection, so your body is reacting to it. So the person has fever. We usually say the fever should be above 38 degrees Celsius. Then this fever also causes the heart rate to go up. So you realize that the person has what we call tachycardia. And also the person will also have very severe lower abdominal pain, usually at the site of the uterus, where the uterus is. Then the person too is going to have sometimes offensive vaginal discharge. You realize that the person is producing this fluid that comes from the bladder, and it's very, very, very offensive.
It's true. Sometimes you can't even stand with the person.
Exactly.
It's true.
So when you have these things, and usually, especially if the person comes and you do not know, you do a pregnancy test, is positive, and the person has all these things, you know that this person has septic abortion. And like we said earlier on, it could be spontaneous or induced abortion that's causing that. So typically these are the kinds, the signs and symptoms that you're going to see with someone who has septic abortion.
All right. So, and we would like to also know the complications with this septic abortion.
So complications of septic abortion are a lot. The gravest and the commonest is usually death. Unfortunately, most people do not come in time.
Before you continue with this, guys, we are at the hospital and I happen to work with the maternity. I'm a community of nurse, as you know. So I was assigned to give BCG to the kids, the first injection that we give to the kids. So I was always with the midwives at the ward, and then we had one client, a 23-year-old lady, and she was through this, and at the end of it, we lost her. Guys, it was so sad that even the guy who impregnated this lady and then gave her the concussion and stuff, and he didn't even come, and then it led to this septic abortion, was even having an affair with a different person whilst the girl was even on the admission. So I just thought of it that no, we should talk about it so that we will talk to our friends, our siblings, our girls, and like we should just talk about it so you know how it is. Sometimes if you sit there and you just be standing and you just see somebody just going like that, it's not an easy as we are saying it, but sometimes so doc, we should continue with the publication. We can also do to help is to give education like we are doing. So thank Dr. Wa for me. He has really done well. Alright, so doc, please let's continue with the complications.
Yeah, so aside the death which normally occurs, you could have cases of infertility because sometimes it can be so severe that the entire womb has to be taken out. The sepsis too can overwhelm the system, causing what we call a DIC, disseminated intravascular coagulation. So where your body is both clotting and bleeding at the same time, and this can be very, very grave, and usually this is what even leads to their death. So septic abortion on its own is not something that we should take lightly, and unfortunately there are a lot of cases there, and these are even the ones that come to hospital. What about those who even stay home and die of unknown causes? Meanwhile they might have,
and then it will be associating with demons and stuff, you see.
Exactly.
All right, our next question for doctor is how do we prevent this? How to prevent the septic abortion?
Okay, so with prevention, we always say that there are levels of prevention when it comes to these things. Essentially and obviously not having sex. Because once you're not pregnant, there will be no temptation to
Terminate
or terminate the pregnancy, or your body may not terminate on its own, what we call a spontaneous abortion, for this to come about. And if you can't, there are also use of contraceptives.
Family planning, guys.
Family planning methods. You can use barrier methods like condom. You can use.
They don't like. They don't like the condom. They want it raw.
I think.
So to add to what doctor was saying about the prevention, I think if you can't abstain from sex, kindly do family planning. It's very simple. With the family planning, we have a lot of methods, and then some people too take the emergency contraceptives as their family planning methods. I think we'll make a video about that later. That's emergency, as the name suggests. It's for an emergency purposes. Maybe you've been raped or something, then you can go in for that. But you shouldn't make it as your daily routine medicine that you take to prevent pregnancy. We have a lot of methods available for family planning. We have the 1 month, we have 3 months, we have for 3 years, 5 years, 10 years. We have a lot of them. So it's better if you can't abstain from sex, then you go to any health center or any health facility, then you get yourself then you do some of this family planning to at least help you. At least that will take care of the pregnancy aspect. You won't get pregnant unless, in quotes, maybe you are pregnant before you go and do it. That one day, family planning commodities doesn't abort pregnancy, because somebody will come, no pass on you at Antiness, me menses into my family planning. You too, since the person is doing the menses, definitely also be a man or be called the catcher said family planning are failing. Meanwhile, she was pregnant. So the moment you get the scan done, when you calculate from the day that she did the family planning and the days or weeks of the pregnancy, you see that the person was pregnant before she came in for the family planning. So guys, we have a lot of them, and I even have all the family planning methods right here on my channel. So please go and check, okay?
So, like we've said early on, you'd see the signs and symptoms. The fever, your heart rate going up, very severe low abdominal pain, sometimes or very offensive vaginal discharge. Most of the time, they know that they were pregnant, and most of them try to abort the pregnancy without any professional. And usually, they don't do it in a place that is accredited or certified to do these abortions.
Also, guys, now it's been legalized. Oh, so please. But my hospital, we are for this one, so we don't do. But other places, it's been legalized. So just walk in. Please, I am pregnant and I don't want the pregnancy. Then you'll be taken care of. Please, stop taking your concussions. Please.
And all that. In fact, after you have attempted, there is no shame. I mean, you've already caused the harm. So it's best to go to a facility and you're evaluated. Then they assess you to see if indeed you are successful with your abortion. If you weren't, then necessary measures are taken to complete the procedure and make sure that you don't have any bad sequelae or aftermath after doing your own or inducing the abortion. So once you notice you have all these symptoms, you promptly report to the hospital, because timely presentation is very vital. You don't want to get to the hospital at a point where it's too late to intervene, and usually people come and it's too late, and now they say that it's the hospital that killed me.
Yeah. Just advise us. We being the young ladies out there, young guys and stuff, just advise us based on this septic abortion.
We've talked about septic abortion. You now know the symptoms that you would experience. You know why you are experiencing those symptoms. And to say that before that, you would follow whatever we have said to prevent it to begin with. And once you have it, to what to do. Yeah, it's unfortunate that we're in a country where people tend to stigmatize. But once you come to a hospital, you have a lot of protection in quote at the hospital. You can come, you can have it done.
Guys, thanks so much, and help me thank Dr. Wa so much. Dr. Wa, thanks so much for coming by our channel today and then giving us this informative education. God richly bless you. So guys, if this video is useful, kindly give it a thumbs up, like, share, comment down below at the comment section. Dr. Wa, please tell them to subscribe.
Can you subscribe?
Oh.
We are aiming at 2,000.
Yeah. So please subscribe to our channel and then be part of this beautiful family. We'll see you again in our next video. Bye guys.